been in a motor vehicle accident or you had trauma that created a sprain or a strain in your neck. So what happened? Essentially, when you have a quick traumatic change in motion, basically that creates either a ligament sprain, which is what holds the joints together. So you can see if I laterally kind of shift the spine, you could see how that might sprain a ligament that holds those bones together. Or as we stop quickly, you can see that motion would really strain these muscles here, and then as your head comes back, would strain the muscles in the front. So you can have a ligamentous sprain, or you can have a muscle strain in the neck, and both really hurt. One creates an instability where basically you have shifting, and if it's really traumatic, you have shifting of the bone during movement, and that is more of a ligamentous sprain, whereas a muscle strain will cause just severe spasm, sometimes severe, sometimes mild spasm of the neck, and that creates muscle tension, sometimes just locally in the neck, oftentimes referring down in between the shoulder blades into the shoulder, or sometimes even down the arm. And there's usually some very common muscles involved. So, of course, the muscles of the neck straight in the back, just what we call the paraspinal muscles or erector spinae, the suboccipitals. Because of that flexion movement there, it kind of quickly stretches those muscles. So it essentially causes, that quick stretch causes a little bit of tearing, and that can cause some irritation to a nerve back here that can also refer up into your head, creating headache. Some of the other muscles are sternocleidomastoid, so SCM, so right there. That one typically, especially if your neck is turned and you're bent either direction, that can create stress on there. And then also scalenes, just holding on the steering wheel. Sometimes people grip really hard, or just they'll kind of breathe quickly, and that quick motion, especially with a quick stretch or movement, will cause strain to those muscles. So any of those or all of those can be involved, and that can cause pain locally into the upper back or all the way down the arm. When we're assessing a traumatic accident or motor vehicle accident, something like that, especially for the neck, we are looking at the whole body because we have to rule out anything that's below. So sometimes we'll do neurological testing of the lower extremity, hips and legs. Usually we certainly do it of the upper body to do any neurological testing, so deep tendon reflex, muscle testing for strength, as well as sensory, just to see are you having any referred pain. And so once that's ruled out or ruled in, then that points us in the direction of what segments, what levels are affected. So then we will often do a range of motion assessment. So we'll just take you through flexion, extension, and rotation and lateral flexion, trying to figure out what motions cause you pain and which motions don't. And that also points us further in what tissues are affected. So for instance, if you turn to the left and you have pain on the left, then that could suggest a disc problem or a facet problem, different structures in the neck, versus if you turn this way and you have tension on the right, well, that's more likely muscular. So that kind of further differentiates and points us in the right direction. So then we do a palpation exam. So we test, kind of push on everything in the neck to figure out what's tight, what's restricted, what's painful. And that further narrows it down. And then we do a McKinsey evaluation, which is a group of repetitive movements that is looking to help you help yourself. We're trying to find which movements make you worse and which movements make you better, so we can tell you, hey, do more of the stuff that makes you better and do less of the stuff that makes you worse. And sometimes it's counterintuitive, so it's important that we take you through that full exam. After we've taken you through a thorough exam, we've got a clear diagnosis, then we can create a treatment plan specific to you. So we will focus on getting you out of pain, basically loosen what's tight, strengthen what's weak, But in the office, we will focus on soft tissue work and adjusting and so forth. So things like active release technique, we found that that really is quite effective for suboccipital tension, so right in the back of the neck, or just anything in SCM or scalenes. All of those respond quite well to active release technique. Also deep tissue kind of massage, as well as trigger points. All of those are quite effective at relaxing the tissues. For some people, they like dry needling, where we can put a needle right in those trigger points and it just relaxes those muscles quite well. We will also continue with any cervical adjusting to really increase your joint range of motion. So we're specifically looking at what segments in your spine are most tight so that we can adjust those and make sure your range of motion gets back to normal as soon as possible. Also part of the treatment process will be your homework. So we will have you do stretches at home, as well as McKinsey treatments at home to assist you to maintain the improvements that we get in the office. So once we loosen things up, if you do nothing, some of that will tighten right back up. So we need to have you help to maintain that extra motion. So again, self-stretches and strengthening, depending on what's weak and what's tight, will greatly assist in improving you and getting you better faster. So all of those treatments together, the adjusting, the rehab, the soft tissue work, all that together works significantly better than any one of them by themselves. So the combination is quite effective and will get you out of pain and feeling better fast. If you'd like help getting better faster, give us a call or request an appointment online. We'd love to help.